We need to understand the pathophysiology of osteoarthritis. So we were taught that osteoarthritis is a wear and tear and degenerative disease, right? Which is not true. You know that. You've been seeing so many patients. Is it wear and tear disease? No. Because if it was wear and tear, every old person will be having osteoarthritis. Does that happen? No, it doesn't happen. Second, does it so if it is worn out knee, does it mean that patient has pain? No. If patient has gross varus, does it mean that he is incapacitated? No. He is going around, so many patients are just going around. Third, if the patient is obese, always does he have knee pain or knee arthritis? No. Even thin patients have knee arthritis. Even obese patients are very comfortable with that.
True.
So there is no correlation between that. So what is it that is leading to, or what is osteoarthritis? Basically, it's a chronic inflammation of the joint to start with. That's the starting point. And then that leads to lot of inflammatory enzymes or inflammatory cytokines inside the knee joint. Once they are there and they are not treated, not drained, they start affecting the chondral layer and the subchondral layer. And that's where actually breaking of chondral layer and the further advancement of the osteoarthritis happens. Now from where this chronic inflammation is coming in the joint, and why does it come in some people, why does it not come in some people? That's an expression of chronic inflammation in the body. Again, where from body is getting inflamed, I will need to give another lecture for that. The gut joint axis. Okay.
Excellent.
So when you have a very bad inflammatory diet, which we all are having, what happens is there is toxins which are leaked inside your body because there is the intestine start permeating these toxins. Okay, so that is gut bone axis, or it's called dysbiosis basically. So these toxins enter the body and they lead to chronic inflammation in the body. It is being expressed at certain joints. Okay, so one is knee. There could be suddenly some people get frozen shoulder without even having anything, like they don't have a tissue injury or they don't have diabetes and still they have frozen shoulder. So that's one of the expressions. Going further, there is an immune element also which has been proven now, that all these chronic inflammation has an autoimmune element as well. So it's not, what we